Welcome to the Dr. Coffee podcast, Mr. Graham Cosgrave, all the way from Ireland. Good to have you here.
Thanks very much for having me, Simon. Yeah, great to be here.
Yeah, thanks so much for your time. And just for the benefit of our audience, you are currently in Ireland and we are recording this over Zoom. So if there's any stutters, any glitches in the line, it's not because of anything we're doing. We have our long distance internet connection to thank.
Yeah, and as ever, I say this a lot of time to the Safas I speak to. Sometimes the connection in Wicklow is weaker than the connection in Cape Town, despite the fact that you guys have load shedding. So do hopefully bear with me, and hopefully the internet will work with us today.
All right. So we got a chance to connect briefly before this recording started, and you work at a place called Match Medics. Tell us about what you do, the services that you offer, and who you're trying to reach.
Very good. Yeah, I guess to give it in a sort of a snapshot, what we do in Match Medics is we help doctors come across to Ireland, and our sort of short tagline is we recruit doctors. So both public and private hospitals across the country are in need of doctors, and we proactively go out across the world to get doctors into Ireland. That's us in a nutshell.
Awesome. I'm interested that you said private and public. Does that mean that there's hospitals in Ireland that are public and there's some that are private? And what's the difference like? Are there differences in standards? Are there differences in waiting times? What's the distinction?
I guess the biggest difference there is probably waiting time. And a lot of the private hospitals, there's a lot of elective surgeries that are undertaken in the privates, whereas the publics, it's covers all specialties for the most part.
Mm. So in South Africa, we're in a transition towards a national health insurance where everyone will be covered by one fund, and it'll kind of be the death of private medical aids, and essentially also make private hospitals much more expensive. Well, that's the rhetoric and the discussion that many people are speaking about. So when you go to Ireland, when you go to a hospital, is a private hospital much more expensive than a public hospital? And is there such a thing as national health insurance? How are the doctors remunerated? I've asked a lot of questions there, but just help paint a picture of the setting in Ireland that you're trying to pull doctors into.
Sure. Yeah. Well, as I said, there's a couple of things to unpack there. In terms of the public system, it's free to access for all in terms of the first point of care. So let's say entering into the emergency department. As of earlier this year, there is no charge to any patient coming into the emergency department. So like a lot of places across Europe, the government's trying to make access to healthcare as easy and as affordable as possible. That being said, any care post entering the primary care setting does tend to come at a cost, and a growing proportion of Irish citizens are getting private health insurance to be able to fund that. When we talk about private health insurance here in Europe, it's nowhere near to what you might think of when you think of, let's say, the US, where it's quite high figures. It's pretty reasonable cost for a family to undertake in terms of covering themselves for the worst case scenario when it comes to keeping their health in check.
Yeah, healthcare in America, I think, is the most expensive in the world per capita by some margin. Just coming back to one of the questions that I asked there, and how are the doctors remunerated? So let's say, obviously, if you're a private doctor, you have to claim from those medical aids, or is it direct cash practices? And then if you're in public, I assume that they're getting a salary from the government, no matter how many patients they're seeing.
That's correct. Yeah. So starting with the latter piece, Simon, any doctor working in the public setting has a public salary. And for every year of service, they move up the public sector salary scale. We can certainly touch on at a later point, perhaps on salaries and the different bands, depending on grade, in a short bit, because there's been some positive news on that front for specialists that we can perhaps touch on in a bit. When it comes to the privates, consultant, it's largely consultant led. There might be some junior doctors who do ward rounds, but it's predominantly consultant led in the privates. And naturally, yes, it's a fee for service that they're getting a point of care. So that's where I guess the enticing element is for a private physician to go into that space.
Yeah, thank you so much for those answers. And now just to build a bit of a foundation, because I'm sure that many of our listeners do not know anything about Ireland other than the fact that they're very good at rugby. So the country itself has, I think you said 5.5 million people or so.
Yeah, as of the last census, we're looking at in around 5.5 million people across the country. Yeah, so still quite small by comparison to SA.
Absolutely. So population size, I mean, that's less than a tenth of South Africa and smaller than some of our largest cities. But what's the kind of doctor to patient ratio? Here in South Africa, for instance, we have more than 3,000 patients per one doctor. So we have a massive shortage of doctors. Are you experiencing a shortage of doctors there that's similar or maybe to the same degree?
We're definitely experiencing a shortage of doctors. I wouldn't say to the same level as you might be experiencing there on the ground. And I guess that's why companies like Matchmedics are operating. There's a need, and that need varies depending on specialty, depending on the location within the country, or depending on the service that's been run. And that's where we come in as specialists to proactively go out there and try to find those people to fill those spots.
Yeah, it makes sense. Like if the population is 5.5 million, you're not going to generate more doctors by building 2 or 3 more medical schools. It's going to take a long time to get more doctors through, right? So that it is helpful to recruit talent from outside. And from the South African context, there are many South African doctors who are looking abroad and saying, hey, are there opportunities further afield? Are there places that I can either go and take my family or go and start a family, or maybe even people are looking to go and get experience with the option of potentially coming back, but not necessarily committing either way. So when it comes to actually moving across from South Africa to Ireland, what are the entry points? At what point in your medical career as a South African doctor? So let's say I've just graduated from medical school. Can I forego internship completely, have no work experience, and just come straight into the system, or what's it like?
Yeah, so I think probably break that down into two pieces in terms of our recommendation. And one is you absolutely need to complete your internship. That's the one part of the qualification accreditation process. So just like your HPCSA, we have what's called the Irish Medical Council, or the IMC. And for your qualifications to be recognised, one of those documents that's required is your intern certificate. So a must-have is your intern certificate. Your ComServe isn't a requirement, but if you have any slightest intention of returning to South Africa, you need to have your community service completed. So our advice is, and again, this is depending, Simon, on a particular individual's circumstance, but our advice would tend to lean to say complete your ComServe and then come over.
Yes.
But you can start your registration with the Irish Medical Council from the first day of your community service. So once you have that intern certificate.
Yes, I think that's great advice, especially if somebody's 25, 26 and they don't know what roads they're going to go down in the next few years, just to wait one extra year, get the community service done, and then they have the option of practicing in South Africa again. I think that's great advice, and I'd wholeheartedly endorse that. So you mentioned that, okay, you've done internship. Let's say somebody's done internship, they've done ComServe. Now they come across to Ireland. Are there any bridging exams that they need to do, anything that they need to do to show competency other than that internship certificate?
No, and that's I guess, one of the biggest draws to, among a few other things, but the biggest draws to come across to Ireland for a lot of junior doctors, and that there's no pre-entry examinations. As your listeners will probably laugh at this. You will have to, as part of the registration, you will have to do an English assessment. So I know the majority of you practice through English and speak English on a daily basis, but because your country's first official language is not English, you will have to do an English assessment before coming across. So that's just part of the registration with the Irish Medical Council. So It's not a pre-entry exam per se. It's an English assessment, is how we label it. And look, the majority of South Africans that we help through this, they fly through it, and they don't fail their English assessment. For those who do, they just do it again, and they get it the second time around.
Is there any limits on how many times you can write that assessment?
Funny question. I've never been asked that, Simon. And I'd like to think there isn't a limit, but I'd like to think you'd pass it after your at least your second attempt, let's say.
Yes. Okay. So at what level does one enter? So you've done internship. Does that mean that you need to do an internship year or housemanship in Ireland, or does one have the opportunity to practice as a general practitioner, whether in public or private? Where are the work opportunities? Because obviously you can't come in and say, I'm a dermatologist without having been a specialist dermatologist this side, right?
Yeah, so look, there's different routes, whether you're experienced or inexperienced, whether you're coming straight off internship or coming from ComServe or a couple of years as a medical officer. So if we're to pick one of those profiles to start off with, let's just say you don't want to do your ComServe, you're coming across shortly after your internship. Just to be aware, the registration with the Medical Council in Ireland can take anything between 4 and 6 months to process. So again, I appreciate some of the circumstances in South Africa. Speaking to people on the ground, sometimes it is quite difficult to get a preferred community service post. Sometimes it is difficult to get a preferred medical officer post. But our advice, again, is when you're processing with your registration with the Medical Council, try your very best to get experience in your field to start off with, and working towards just making yourself as employable as possible in that time frame that you have to get your registration. So talking about that, just recently completed, intern, they're taking a few months out. Let's say they're doing a bit of traveling. They might pick up, a bit of, work post their internship whilst their IMC is getting completed. We will then, I guess, in terms of our grading system, there's senior health officers, there's registrars and consultants. We would be able to get them an SHO, so a senior health officer position starting off with. Now, naturally, and again, I'm sure it's quite similar in South Africa, there are some specialties where there's a higher demand than others. And I would see these as, even if they aren't your preferred space or specialty, see them as a stepping stone. So if it's emergency medicine or internal medicine or pediatrics, these are probably some of the easier specialties to get in to initially. Use them as your stepping stone to get into the system. And once you're here for 6, 12, 18 months, it's far easier than to navigate your way into a different preferred specialty after that.
That's a really, really helpful answer. Thank you so much for that. So the next question kind of dovetails with that nicely. You mentioned getting experience as much as possible. Here in South Africa, we have the Colleges of Medicine of South Africa that offer short diplomas, as well as you have to do all of your fellowships or your registrar time via the Colleges of Medicine in South Africa. So the body that kind of oversees all of the exams. So if you want to be a surgeon, you have to do your FCS. If you want to be an internal medicine physician, you have to do your FCP. But like I say, there's diplomas, right? So some of them are 6 months, some of them are 12 months. If you were to do a diploma, let's say you did 6 months diploma of anesthetics here in South Africa, would any of that experience translate to opportunity in Ireland, or would you need to get similar qualifications again in Ireland?
The short answer is you would have to get similar qualifications in Ireland. But what it does do for you, again, going back to that employability piece, if you've your DIPEC or if you have your diploma in anesthesia, whatever it might be, that just helps your CV stand out and helps you get into an interview. It also shows your interest in that space, that you've already started to progress your career in that direction, and it just helps you in an interview setting. But as I said, you would have to then again go and do the equivalent Irish or UK standard qualifications once you do end up on this side. But just to be clear, it's not a requirement. It's a nice to have, but it really does help showcase you and shine your CV outside of all the other competition that you might be going up against.
Graham Cosgrave, thank you so much for answering our questions about just setting a foundation about practicing medicine in Ireland, when we can come across and how we can start to enter the system there, as well as giving us a bit more clarity about the health system in Ireland and how people can start working there. Now, I want to dive a little bit deeper into what Matchmedics does. So the services that you offer and how you can partner up South African doctors with placements in Irish posts.
Great. I'd like to kick it off, Simon, by debunking a myth. And people are always curious, well, this all sounds great, but how much is this going to cost me to use you guys? And it gives me great pleasure to tell doctors that it'll cost them zero. €0, €0, $0, whatever currency you want to talk in. It costs you as South African doctors nothing to use our services. How we operate is we charge the hospital for finding you. So when you start on day one, we send them an invoice for finding the hard to find doctors. That's essentially how we operate. So any questions, as we say to our doctors, big or small, we'll happily guide them through it. And as I said, you can do that happily because it will cost you zero. So that's the gory bits out of the way. In terms of what we do, aside from being recruiters, aside from getting people jobs, we appreciate this is a big move, and we want to give our doctors as much insight into the move from start to finish. So from the registration to what it's like to bring your kids over, and in some instances, people are bringing their partners, their kids, their four-legged friends, and we're helping people literally relocate their whole lives. So to us, the job is one part of a wider puzzle, and we try and do our very best to help that all happen. So starting off, and after this, Simon, I can certainly share what we call our ultimate guide to moving to Ireland, which you could share with any of your listeners who are interested. And within that brings you through the whole journey in terms of getting registered with the medical council, to us helping with your CV, and proactively going out there to share your CV with hospitals. And once we have interviews lined up, we do thorough interview preparation sessions over Zoom or over Teams, whatever it might be. You may be able to relate to this, Simon, or others who are listening. Most staffers we deal with don't do interviews. They don't have any interview experience whatsoever. So for us, it's a key sort of piece that we can offer our doctors to just put their nerves at ease, give them a bit of Irish intelligence, give them a bit more insight into the type of questions that are asked, and just help them ace their interview. And I like to call ourselves as doctors champions at this stage. We're trying to cheer you on and prep you as much as possible to get you that job. And then once you've accepted the offer, that's when the fun starts, when we look at accommodation, schools, the whole relocation piece. And more often than not, we try to link you up with another South African who's here, who will give you much more of a clearer insight into the day-to-day life. Because me, being Irish, I can tell you how amazing my country is. I'm biased. If you speak directly to one of our other South Africans who's living and breathing this journey, they'll give you a very real perspective in terms of the pros and the cons about the move. But I said the majority love life here, and would encourage others to make the same move too. So that's our service in a nutshell. And I said it's totally free for all of our staff and doctors to use.
I think I'd love to dive into the experiences of some of our expats who've moved over to Ireland, and some of the things that they've shared with you, some of the sticking points, some of the difficulties. But before we go that way, obviously you do as much as possible to help the doctors into that transition. And for somebody who's 24 years old with no attachments, they might have a cupboard full of clothes, and that's their entire worldly possessions. A move across to Ireland would be quite easy. But for somebody who has a family and kids, just how far does it go in terms of, do you help them find a school, or is that something that they need to do on their own? And then in terms of housing, I mean, you can't buy a house for them. So do you put them in touch with real estate agents? How does that happen?
Yeah, I'd gladly go through that piece. So, to paint the picture, most of the people that we are dealing with, there's a mix, of course, of recent comm servers, but a large proportion are medical officers, or some of them might be specialists, and they're coming across with their kids, and they're coming across with their partners, and I said some instances their pets. So we try our very best, to get involved in that whole piece. So once the job is lined up, we will, share our team of sort of compliance and relocation experts. Will do our very best in recommending particular neighborhoods to look at for accommodation. In some instances, we can put you in touch with local estate agents, and I'm sure your listeners are in tune with Google and the benefits and drawbacks that come with it. Google away when it comes to accommodation, when it comes to Ireland. Like, yes, you'll see bad press that there's a housing crisis and there is a shortage of housing. I'm not going to sugarcoat it. There absolutely is, but that's why we step in to help our doctors moving across to find suitable accommodation for them, and work directly with a lot of local estate agents to try and smooth over that tricky piece. Let's not deny it. It's a challenging piece and a daunting piece for a lot of people coming across, that they don't want to be homeless moving to a brand new country. So we totally understand that. So we want to help with that piece. Following that, we'll, based on where we find you a hospital, all of these tie into each other, Simon, you can see. Where they find a hospital, we encourage or sort of recommend local areas based on those local areas where they're going to live. There's a very strong public free to access schooling system here, and we would recommend a local school to them based on that. If they're younger, the recommendation would be childcare or sort of private child minders, if that's the preferred space there. If their partner is in a non-medic and they're looking for work themselves, we will at the very least put them in touch with a recruiter in that space. In some instances, we can actually guide them even further depending on their background. And then for the four-legged friends, I appreciate a lot of people are when we say moving lives, they're literally moving their entire lives. So we'll give them insight in terms of having up-to-date pet vaccinations and pet passports, which airlines are better to go with when it comes to flying across with them. So all of that piece comes into that whole relocation. And as you can see now, the job is just one tiny piece in all of that whole operation. And how we like to tie it all off is, once our doctors come across, we try our very best to meet them in person, give them a welcome pack, a small little gift pack to just give them a nice little warm welcome to Ireland, and finally put a face to the person that we're dealing with for, in a lot of cases, 6 to 12 months before they do end up actually moving across here. And we will help them along the rest of their journey in their career here in Ireland too.
Graham, if somebody was to stay in Ireland, how long would it take for them to become a permanent resident or a citizen? I mean, I imagine that you can't just come to Ireland for a year or two and then say, I now have an Irish passport, or my children born here are citizens right away. Like, what are the legalities there in terms of getting that citizenship, or getting, I guess I want to say, the rights of being a permanent resident? Because I imagine that there is a distinction between a foreigner working in Ireland and somebody who's been there for a long time.
Yeah, a very good question, and that's again something that I'm asked on a daily basis, and that is, what is my pathway to getting an Irish passport? Good news is we're the quickest country in all of Europe to get a European passport. So it takes approximately 5 years in total to get an Irish passport. Now, some people's journeys might vary slightly, but the standard is 5 years. And there's different, they call them sort of stamps. There's different stamps to get along the journey. But for the most part, you're eligible come your 4th year, and then when you apply, and then in most cases it takes 6 to 12 months for that to come through, and then you'll be fully fledged Irish by the end of those 5 years, and you get a nice they make a big deal of it, and there's a nice ceremony in a certain depending on the time of year, a nice ceremony to sort of welcome all these new Irish citizens, and give out Irish passports to those who have committed to their lives to Ireland, paying Irish tax, and working in the country. So it's that it's a relatively quick process if someone's looking for a longer term move across here to Ireland.
So what is the general experience like for doctors moving across to Ireland? Are the public very receptive and warm towards South Africans? I imagine that it depends on whether or not we've been playing each other in rugby, but are the public very receptive and receiving of South Africans? Do we compare well to the doctors in Ireland?
Yeah. Well, I'll give you two pieces to highlight. I guess their receptiveness. One, South Africans are the fourth highest nationality to be registered to practice medicine in Ireland. So that just gives you an idea of the sheer volume of South Africans currently living and working as doctors here in Ireland. Outside of that, of course, there's obviously the add-on South African community that comes with those medics. So genuinely, I say this to most doctors, basically every hospital across the country, you will struggle not to find another South African doctor. So, when it comes to their reputation as medics, the first protocol for a hiring consultant coming to me will be, find us more South Africans. Your reputation is so high here because, and again, everyone will be able to relate to this who's listening, from day one of your intern, you see everything. And that's the key thing, I guess, to convincing the Irish consultants, at least in the hiring teams, that you are a good pair of hands to bring into the system. One big thing to sort of highlight there is coming across. Irish consultants know the experience that you have. They also know the experience you don't have, and they're keen to bridge the gap between the two. So that's, I guess, in a nutshell, how South Africans are certainly received here. If I can, and we get this quite often in terms of talking about the topic of race, because of course South Africa is such a melting pot of cultures. People will naturally, when we're talking to them, think that everyone in Ireland looks like me, a pale, freckled, ginger-haired Irishman. We're not all like me, and of course you are going to get idiots in most corners of the world, but for the most part, Ireland is a very accepting, very warm, very welcoming country, and really our history is steeped in our Irish people going overseas. So we know the feeling of having to move to another country to look for a better life. And we can relate to that journey that a lot of our doctors are coming across to, because our ancestors did exactly that. Maybe not as extreme in present day, but we can certainly relate to that whole immigration story.
Wow. This might sound like a really bizarre question, but at this time of year, we're in the process where people who are finishing up their medical school studies are about to enter internship, and they're all waiting to find out where they've been posted, because the postings come out at the end of November, and then you start your work experience from the 1st of January. There is a lot of competition for trying to get the best hospital for internship, and certain hospitals have reputation. So do you know any hospitals that stand out? I mean, what I'm trying to ask is, if you were a Chris Harney Baragwanath intern, does a Barra intern have more standing overseas than somebody who did their internship at a smaller district hospital, or is it seen the same?
The exact same. If you're coming from South Africa, you're qualified in South Africa, and you've done your intern in South Africa, you're considered the exact same as someone from further up in SA. So it's all the same.
Graham, you don't know how useful and helpful that answer is, because there are people who think that they come from a school of thought that if you're not a Barra intern, you're not worth your salt, or if you went to this hospital, you're missing out on something. And one of the encouragements that I always have for our junior doctors and our medical students is that internship is designed to train you and designed to give you exposure, and those hospitals have to give you that exposure. If they don't, you don't get accredited as a training site. So it's helpful for you to answer that so that people don't think that, oh, I did my internship at a lower level hospital or I did it out in the Bundus, that therefore they're not going to have the same opportunity as somebody else who was a Barra intern or a Groote intern. So that's actually a very helpful answer on this end of the call for our South Africans to hear. I think you've done a great job of giving some insight into the experiences of doctors. Do you have any some wins or some good stories of people who thought that they were going to face a challenge and your services have really helped them to adjust well?
Yeah, yeah. Let me. I'll give you a couple of. I'd like to think relatable stories that some of your listeners will be able to see something in themselves. One in particular, a young couple who I met. I was as part of the Matchmatics team. I was out in South Africa last March, and we did a roadshow across the country, showcasing what Ireland's got to offer. And one couple who we met on that road trip in Cape Town had just finished their ComServe, and they were sort of in two minds. They didn't see a long-term future in South Africa for themselves. They had family in different parts of the world. They'd heard about things in Ireland, were unsure, what was there on offer for them. And from meeting them in person, that solidified that idea. Let's give Ireland a try. And most doctors do have that sort of opinion going in. Let's go into this thinking, let's give it a year, let's give it 2 years and see how it goes. And I can honestly say a large proportion then after that do decide to make Ireland their long-term home. But for this particular couple, one thing that struck me the second time I met them was in Dublin, only a few weeks back, after they just started their job as minor injury physicians in a private setup in Dublin. And I asked them, what's the biggest difference you've noticed in Ireland versus South Africa? And they said, your postal service is really cute because it works. And to me, as an Irish person, our Irish public postal service is called An Post, which is Irish post, and it works, but I think take it for granted. Whereas when the couple told me this, they said back home in South Africa, you don't send stuff in the post because you don't know if it's going to get delivered. Whereas something as simple as us sending something in the post can so easily be taken for granted here because we know it's more than likely going to get delivered. And it's just some South African nuance that we're just not aware of here. So that was just one particular example. I'd love to give another one where I think maybe some of your more experienced listeners might be able to relate to, who have families. And this doctor I brought across, she's a pediatrician, brought across from Durban to work in a university teaching hospital just north of Dublin. And I asked her the same question. I asked the young couple, what's the biggest difference you found between South Africa and Ireland? And she said, I can now let my kids go out into the cul-de-sac in the neighborhood and play away and not have any worries whatsoever. And again, as an Irish person, I take that so for granted, that feeling of safety and security, being in South Africa and being in this industry, working with South Africans for over a decade. I know safety and security and stability for your family is quite a big thing naturally. And it's a big motivator for a lot of people to come here. And I shared that example because I'd like to think a lot of young families will be able to relate to that the job is really secondary in that scenario. It's peace of mind. You can go to somewhere brand new with a young family and have, no cares, but have less worries about their safety than you might do in somewhere like Durban or any of the other cities across SA. So there's two real life examples of people we've helped move across. I'm going to give you one final one, I think, which will really solidify the long-term potential. There's this lady, an emergency medicine consultant from Cape Town, we brought across as a middle grade doctor about 5 years ago. And she just wanted to get into the system and get to know what it was like. She moved across with her husband, who's an IT professional, and a couple of dogs. We got her first job. She then moved into a Dublin teaching hospital, who saw real potential in her and helped her get her registration to be a consultant here. She is now a consultant in a hospital down in the south of Ireland. But more importantly, aside from work, she has property here. They own their own home here. They have a miniature animal farm with alpaca and donkeys and chickens and all kinds, and a vegetable patch. They have very clearly settled here in Ireland. They are Irish. They're on their journey to getting an Irish passport. And they are a true example of people who, when I first spoke to them, were so skeptical, thinking, this can't be real. This sounds way too good to be true. And now they're living and breathing an Irish life here. And that is an example I shared because that is something that is very possible to other people listening to this today.
Graham, we've had a fantastic conversation. I think that you've dispelled a lot of myths. I think that you've given people a lot of very useful information. And if people are interested in making the move across to Ireland, or even if they just want to make connections with you and ask you more about the process so that they can make the decision for themselves, where can we find you? How can we make contact? How can we start the process?
Yeah, great. Well, there's two channels you can find us, either on matchmedics.com, or we have a private Ireland-focused Facebook group called the Doctors Huddle, where you can find everything from jobs in Ireland, from tips on getting through the registration to where can you find your local BRI, all things about living and working in Ireland and finding those South African treats that you might miss when you move away from home.
Awesome, Graham. We'll link to that in all of the show notes for this episode. Once again, thank you so much for your time, and thank you for appearing on this episode of the Dr. Coffee podcast.
Thanks for having me.